All right, here we are again with John Gallucci Jr., President, CEO of jagpt, certified athletic trainer, and a physical therapist. You've done it all, John.
Hell of a nice guy, too.
Yeah, you are a hell of a nice guy. Let's talk about some of these injuries that have started to affect some big names in the NFL. I think the most shocking one was Deshaun Watson. He was at an up and down season, really a lot of down season, but he had a non-contact Achilles tear. I feel like we're seeing a lot of these recently. Maybe it's shoes or training or whatever it may be, but how devastating is the Achilles injury?
Well, as you know, an Achilles injury, he's going to need surgery. He's out for the year. And he's got a year of hard work in front of him where he's going to have to rehab and try to get back. The biggest thing why we're seeing a lot of these tears throughout all leagues is the tremendous amount of stress that we're putting on backpedaling, and we're not really paying attention to surface change continuously. There's a lot of research going on in reference to surface change, and is that a key factor? Or sometimes it could just be wear and tear and it pops. We are human.
Yeah, we are. And we see these a lot relative to the artificial surfaces that we're playing on. So that's something that the league and the Players Association have been talking about for a lot of years now. Let's go to another quarterback injury. This has nothing to do with the surface. Aiden O'Connell, quarterback for the Raiders, broke his thumb. Now, I've done this when I was playing. I broke my thumb. They just kind of taped it up, and I played with it. I still had use of my top of my thumb, so it was fine, and it healed. But for a quarterback who hit his hand on a helmet as he was following through, it should be devastating. How do you make sure you get full movement back?
That's an awesome question. So the biggest thing is I was a wrestler. I dislocated my thumbs. I broke my thumbs. But at the end of the day, as you said, a couple of weeks, we taped me up, and I used the other 4 fingers to wrestle. When you're a quarterback and you've got to grip the ball and you've got to throw a perfect spiral, you need your thumb. And ultimately what you're going to see is they're going to wait for that to heal. It's going to take about 4 to 6 weeks to heal. He's going to go through some great hand therapy, a lot of strengthening. But as you said, range of motion is huge, especially in gripping the ball. So you'll see a progression, but they can't do anything as far as that until that bone heals down.
Yeah, it's just going to take time, I assume.
It's going to take time. But the really unique thing is, as we know, athletic trainers and physical therapists are going to keep him aerobically fit, going to keep him strong, going to keep his core as a quarterback. They're going to make sure his whole body is fit, strong, and ready to go. So when that is healed, he can get back into the game.
Let's get to, I think, the most devastating injury that we hear. I've heard it for decades, the ACL. Brandon Ayuk, wide receiver for the San Francisco 49ers, took contact as he was making a catch on his lower body. It just kind of opened up that anterior capsule on his knee, and we found out a day later that he had torn his ACL. It's devastating. But when you're a smaller player, because he's a smaller player, he's not 300 pounds, how quickly can you recover from that once you get the surgery?
Well, it's research shows us this is a 9 to 12 month injury, just based on the proper healing of the human body. We used to rush back. Back when you were playing, it was all about, hey, who can get a ACL back quicker? Can we get him back in 4 months? Can we get him back in 5 months? Well, research over the last 15 years has showed us that the integrity of the healing of the tissue is very, very important. And we try not to bring especially professional and high-level athletes back until 9 to 12 months. And he's out for the season. They've got until next season to get him back, so they definitely have the time. First thing is, of course, getting him into surgery, getting full range of motion, function and strength is a thing, and then back to football drills and things like that. But we're looking at 9 to 12 months before we see him back functioning.
Yeah, he fought really hard to get a contract before this season. Luckily, he got that signed.
Luckily, he got the contract. And if you look at the film, it's actually a very classic opening to see that most likely he tore his ACL.
Right. Let's get to a quarterback was taking the NFL by storm as a rookie down in Washington, Jaden Daniels. So he's a running quarterback. The Washington Commanders lead the league in scramble yards this year. It's like 200-300 yards scrambling. And a lot of that is because Jaden Daniels is not afraid of contact. Now, he got hit and twisted and landed on oddly, and it looks like he has a little bit of a rib injury. I'm not sure if it's a fracture, but even if it is, how long will that take? Because as a quarterback, so much of your movement, throwing the ball, or even running, is in your intercostal area, correct?
So think about the rotation of throwing a ball. Think about the movement of cutting it, and think about what you did. Just the breathing component. Everything is an expansion of your chest cavity. And most likely, we'd rather it be a fractured rib than a costal cartilage injury, because that takes longer because of the expansion continuously. So ultimately, they're going to monitor him for pain. They're going to monitor him for function, and they're going to bring him back slowly to make sure that it doesn't happen as a re-injury, especially if it's a costal cartilage where that irritation is just going to continue. You can't have a player go out there playing a 6, 7 out of 10 pain. So they want to get these people back. They want to make sure that he's rehabbed appropriately. But again, you'd rather it be a break than a costal cartilage.
You know the bone will heal.
Yeah.
That's the most important thing. Let's get to a broken bone that I had trouble watching this one. Aiden Hutchinson, defensive end for the Lions, got a tib and fibula fractured. We often see the fibula, which is the outside smaller bone in your lower leg, but to break your tibia, that's hard to do. What's the rehab going to look? We know what the scar is going to look like, but what's the rehab going to be like for him?
So the first thing is that video is going to be in orthopedic medical schools, physical therapy schools, and athletic training schools for years, just basically treating the trauma, treating the injury, getting the athlete to the hospital, making sure everything was good for the athlete to have surgery. Now, post-surgery, it's like anything else. They probably pinned him and rotted him. It's going to be 6 to 8 weeks before he's really functional. Then they got to bring him back slowly, strengthening-wise, balance, really make him get back to football activities. We're talking about this is 9 to 12 months that he's going to be out. But think about how fortunate he is to have a medical team on the sidelines that knew exactly what happened and get him off to the hospital as quick as possible. So he's pretty lucky.
Right. Now, he said if the Detroit Lions make the Super Bowl, which is six months from now, 5 months from now, he wants to play. Is that even possible?
It's going to be real tough. I mean, I'm doing this for 30 years. That's a pretty aggressive tib-fib fracture, as we saw on television. The surgery, we're talking about 8 to 10 weeks before he's going to be able to even be walking normal. So now we're going into 3 months of walking. Then we're talking about strengthening. That's another 6 to 8 weeks. Then function. That's another 2 to 4 weeks. Yeah, it's going to be really, really tight, really aggressive. And now you're opening up yourself and predisposing yourself to other injuries and soft tissue things. So I think he's got to be patient, listen to his medical staff, and see where he's at.
Right. So we're filming this on a Tuesday. Last night on Monday Night Football, we saw an injury in the Tampa Bay game where Chris Godwin dislocated his ankle. This is, I think, different than a fracture, but I don't think a lot of people understand. I don't even understand. What's the recovery like from a dislocation? Because in theory, you can relocate it, correct?
So a dislocation is reduced. So the doctors will reduce the dislocation, but then you have to send them for the appropriate test, the MRI, make sure there's no fractures. But most likely, if the joint came in and out, you've torn some ligaments. And the question is it torn? Is it stretched? Is it strained? So it's really a component that the MRI will tell us exactly. Yes, it was dislocated, but what ligaments are in a situation that they're not functional. If they're functional, they're just going to rehab them and decrease inflammation. If there's a full tear, he's going to need surgery. And you're talking about 3 major ligaments: your anterior, posterior talus, fibula, and your deltoid. Any one of those 3, based on his position, are torn. He's going to need some sort of surgical intervention.
And then he'll be out for the year. If he needs surgery, he's out. Maybe he has a chance.
Correct. And listen, again, going back to my sport, wrestling, we would dislocate shoulders, go for an MRI. If there was no tears, we'd be back in 2 to 3 weeks. So let's hope. But I'm doubtful. I think he probably has a ligament tear.
Yeah, you and I are from an era where if it didn't hurt that bad, just go play.
Put some dirt on it. You're ready to go.
That's no longer the case. John Gallucci, President, CEO of jagpt. I appreciate you, my friend.
Thank you.